I finally figured out how to do everything. And I'm sorry I was having the sound was a little weird in the last one, but this one should be better. So we're just talking more about therapeutic communication. So it never ends. Um, and again, this is looking at how it's the communication process. So there's a reason why you're communicating. The patient comes in the hospital, you need to orient them to the unit and say hello. So as the sender, initiate the contact, you send a message. Channel is, can they hear, how is communication received? And then the receiver is a person who interprets what is sent. And we know sometimes there can be some mix-ups between the sender and the receiver. We're going to play a little game tomorrow that's going to show how sometimes things can get messed up during that channel of communication. All different things affect communication. Lots of different things, relationship factors. How do they relate to you? What are their personal factors? Are they shy, scared? Have they had a uncomfortable experience or a prior traumatic experience in a hospital and now you're in a hospital with them? Is it storming outside and they're scared? Is it, obviously you guys can come up with lots of different things like that. So verbal communication is everything you speak, right? So it's the words you say. And as we know, it can convey a lot of different things, from our tone to how we say things, to how it's interpreted. Sometimes tone can be misinterpreted, but that's when we're talking about verbal communications, we're talking about the words and the tone and what comes out of your mouth. Nonverbal, tone is nonverbal. Verbal is the words coming out. Tone is the tone underneath it. So if I said, everyone look at the PowerPoints, even though my words are everyone look at the PowerPoints, the tone of how I said it conveys the idea that I'm angry, right? So I'm sorry, tone is nonverbal. I'm sorry, I made that mistake. Or I put an emphasis on certain words, please don't be late. That would show annoyance versus please don't be late. How I look, my physical appearance. Do I seem bored? Am I actually facing you, or am I kind of distracted looking the other way? Am I making eye contact? Am I using my hands? Those are all ways that you convey messages that are not verbal. And as we know, there can be mistakes, and people sometimes are not aware of how their behaviors come across. Think about that phrase like resting bitch face. Like, I think a lot of people who have that, I always say my mom has that, and she seems so unapproachable and mean, and she's just not at all. It's just sort of the way her demeanor is in her face, and she just comes across like that. And so that's a perfect example of a nonverbal message that sometimes people aren't even aware they send that message out. And so when you think about verbal messages are the content, that's the words, and nonverbal is the process. So it's sort of everything else that surrounds the words. A double bind message is when you give two contradictory messages at the same time, and it's usually given by someone in power. For example, which behavior from NOAA would be considered a double bind message? It's C. He sneers at you and almost purrs. He says, "Oh, yes, I will tell you anything you want to know." Of course. Yeah, of course I will. So the behavior is not consistent with what he says. He's saying, "I'll tell you anything you want to know." Let's pretend Noah is a patient that you're interviewing. But the way he says it, he's basically using tone to let you know that's not true. At first, when I looked at it, I thought it was A. But actually, if someone winks and says, "Do you date 15?" So let's say Noah is this 15-year-old boy, and I'm interviewing him, and he winks and says, "Hey, do you date 15-year-old guys?" His behavior is actually consistent with what he's saying, right? He's like winking and saying it. So that's consistent. And same with B, it's consistent. He's shaking his head. I don't want to do this. His behavior is consistent. Same with the last one. But in C, his behavior and tone and is very different than the content of what he's saying. So you may see that in a test question, so make sure you understand that. Again, we've talked all about this, and we're going to spend some time in class talking about using silence. Listen, 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 listen. It is more of a one-way conversation than two. You need to be listening to what your patient is saying. one way to do that is to use silence. And it's important to get used to being okay with silence, because especially someone who may be processing things a little bit slower, who may be under stress, duress, hallucinating, those kinds of things, it can be a little harder to formulate thoughts. If you're very upset, it can be hard to formulate the words, and you need to allow someone more time to do that. And if you continually cut them off, you're not going to be able to actively listen to what they have to say. You need to allow them time to put together what they're trying to convey to you. And you can clarify, it sounds like your mother was very strict with you. Tell me a little more about that. Trying to clarify. From what you're saying, it sounds like your mother was very strict with you. That you're trying to clarify. You're trying to get them to give you a little more information. I'm not going to go through all of these because we're actually going to practice these in class. But please read them. And don't just read them, make up examples for them in your mind. You need to be able to have an example of it because that's the only way you'll remember it. So again, I'm not going to go through this because we're going to talk about it in class. We know the difference between open-ended and closed-ended questions. At times you will ask a closed-ended question. Are you on any medications? Right? Do you feel suicidal at this moment? There are times that you need to have a clarified, that was me using nonverbal communication, a very clarified message that you need to know exactly what it is. However, often an open-ended question allows for the other person to expand a little bit more thoroughly and help to clarify it for you. All of this is not helpful. Why? Why is looked at as judgmental. If you ever see why as one of your questions, it's not going to be the right answer, right? Remember, always go with safety. Always ask if someone's suicidal and never choose the why one. Never give advice. Don't approve or disapprove. It's really important to stay neutral because your approval doesn't matter. You're really more of a sounding board to help them problem solve. And you want to pace it. If you are using excessive questioning, you're going to not get through that orientation phase and they're going to be frustrated and it's not going to be a therapeutic relationship. There's a lot of new kinds of things out there for with technology. There is one where, and I can't think of the name of it, but you can actually do a therapist that you text with. And so these are one of the things. There's all different apps. And we're actually going to practice some apps and talk about some apps I may have you guys review for me tomorrow. We've talked all about this before. Pace, is the setting conducive? If you go to an area that's quiet, let them know you can have their undivided attention. If you're constantly getting interrupted, if you're constantly having to turn to talk to someone else, they do not feel that they're important. And you need to establish that trust. So these are all just things, obviously you guys can read these. As hard as it is, you don't want to give false reassurance. All different things to try to avoid. But making eye contact, maybe position your chair at 90 to 100 degree angle because sometimes face-to-face is a little bit hard. When they talk about personal space, this is going to be something that when you think about boundaries, and that sort of idea between a personal distance and a social distance is probably where you want to be when you're interviewing someone. So again, kind of something to think about. Today, when we threw the yarn around, I also have noticed that in groups, sometimes people like to do something with their hands. And so that's why coloring can be a really great thing to do while you're talking and in a group, because people sometimes feel more comfortable sharing if it doesn't feel like there's just direct attention on them. So that's something else to think about. A process recording is when you actually sit and you try to really write down almost everything that has been said between you and a patient. And it's a way to look at your communication patterns. Just be aware of what it's called. That's called a process recording. All right, that's it. And I've actually figured out for the first time how to be done. So